When you look at the brain images that we were talking about earlier, one of the things you notice is that there's very little activity in those frontal lobes, as I mentioned. There's a foundational reason in alcohol use in particular that's the underlying cause of that issue. And that's that when people are consuming large quantities of alcohol on a daily basis, their normal healthy gut bacteria that we all rely on, and people are more and more aware of this, it's called the microbiome, that normal gut bacteria needs to be there for us to absorb certain nutrients. So if you think about it, alcohol is a solvent, right? We use different kinds of alcohols, like isopropyl alcohol, for example, to clean things. So we know that it essentially is a disinfectant, and what that means is it's destroying that healthy microbiome. Alcohol also has a direct effect on the lining of the intestine, so it can become inflamed. And so for both of those reasons, people aren't absorbing key nutrients. Those precursors are actually really important for healthy brain function. There are 20 different key nutrients that we're replacing at North Star. But I like to use the example of magnesium because there's some really interesting things about magnesium deficiency. Number one, it's widely known. If you went up to any physician and asked them, what will the magnesium level be in a patient who drinks daily? They will tell you that their magnesium will be low. It's widely known. This happens because the kidneys actually lose magnesium. Anyone who's drinking is losing some magnesium every time that they drink. But if you're drinking daily, you can imagine that the magnesium levels are getting lower and lower. Well, magnesium has a calming effect on people. And so when your magnesium levels are getting low, in effect, you're removing this calming influence and you have an agitated or anxious kind of brain activity. And that actually drives people to consume more alcohol. Low magnesium causes people to crave more alcohol. So this phenomenon where people may be drinking late into the evening, they wake up in the morning and they have cravings to drink immediately again the next day, in part, it's because they're trying to calm that hyperactive brain activity. And that calming, unfortunately, comes at a cost, and that's losing more magnesium still. By the time patients get to our program, they're sometimes at levels that are so low, we actually have to do either a combination of significant oral repletion, or we even sometimes have to give them injectable magnesium to get them tanked up. But low magnesium levels cause all variety of different issues, and some of them most people are familiar with. They may be aware that people who drink heavily are at risk of seizures. Well, this is a piece of why. They may be aware that people are prone to having heart issues as a result of alcohol. Almost a third of people who go to the emergency room with a heart rhythm abnormality called atrial fibrillation, almost a third of those patients actually have an alcohol issue as the underlying cause. And so it's these electrolyte abnormalities like magnesium loss and potassium that's affected by that can trigger these other downstream issues that have a huge impact on patient outcomes.